Hello, I'm Bob Kaiserman for the National Library of Patient Rights and Advocacy. My guest today is Dr. Elizabeth Gosch. Dr. Gosch is a licensed clinical psychologist who is a member of the faculty of the Philadelphia College of Osteopathic Medicine, where the conference recently took place. Dr. Gosch is board certified by the American Board of Clinical Child and Adolescent Psychology, serves as a diplomate examiner for this board. She's a nationally recognized expert on clinical child psychology, anxiety disorders, and cognitive behavioral therapy, CBT, with youth. She has published on several topics, but is best known for co-editing the book Anxiety Disorders, a Practitioner's Guide to Comparative Treatments. She has written articles on the treatment of internalizing disorders in children. Although she has received certification in cognitive behavioral therapy with youth from Temple University, she has also received training in family and psychodynamic approaches. She believes that therapeutic change in youth must be understood from a developmental perspective. She strives to integrate findings from the field of developmental psychology into her clinical work. Her private practice, she works with youth experiencing both externalizing and internalizing symptoms, but specializes in the treatment of anxiety and depression. Welcome, Dr. Gosch, and thank you for joining me today. Please explain to our audience why CBPT is used to help young children with anxiety and depression, as opposed to perhaps other tools that you would have in your toolbox to treat these children?
That's a very good question. Really, cognitive behavioral therapy is one of the most empirically supported treatments for children who have anxiety and depression. And so there's a lot of clinical trials that have been done, and I've been lucky enough to participate in a number of them that have really firmly established the usefulness and the benefits of cognitive behavioral therapy, especially for children ages 8 and up. But even for children around 8 or 9 or even younger children, there is some question about whether the modalities by which cognitive behavioral therapy operates, being able to know about what one is thinking or how one is feeling, being able to talk about one's internal states, being able to communicate in a way and understand language in a way that will help them be able to learn or be able to benefit from therapy. You know, for younger children, their mode and their way of being in the world is really sometimes better suited for cognitive behavioral play therapy. Because they can utilize play, they can utilize creating stories, creating vignettes with figures, creating different kinds of situations and how to manage them. I mean, children learn how to manage all kinds of experiences through play. I remember when my daughter had surgery when she was a young child, she was about 4, and it was so helpful for her to have a doctor's kit afterwards to play with her toys and act out being the doctor and having the procedures and things happening and being scared, but comforting them. She acted out like a lot of the things she had seen and experienced. It helped her understand her experience. It helped her master her experiences and have a sense of control, competency, being able to kind of manage her feelings around them and understand them in a different way by different things that would happen in her play. And we know that children, there's a great body of evidence that supports that children utilize play in those ways. And so the great thing about cognitive behavioral play therapy is it utilizes modality of play to help children communicate, to help them understand, to help them learn mastery. But it also is based on many of the tenets that we know work for older children and adults for the treatment of depression and anxiety. Ways to help them change how they're thinking, ways not to feel more in control of the situation, to be able to learn skills, coping skills, and different ways of seeing themselves, different ways of viewing the world, changing their beliefs through play, changing their ideas about the world through play and their experiences through that. So therapeutic play is different than just general play, that's for sure. But it certainly does provide that for children. And so it's just such a wonderful marriage of two very powerful modalities to bring them together to help children benefit, especially children with anxiety and depression.
Um, Very curious, in the introduction, I mentioned your book. When was the book published and how is it being used today?
Which exact book are you referring to? Because there's a couple. So
One called Anxiety Disorders, a Practitioner's Guide.
um, I think I had written that was a book that was from different theoretical orientations. People had talked about how they would treat a particular case example of someone who was experiencing different kinds of difficulties in their lives and had certain strengths as well as the difficulties they're experiencing. But and that book was really utilized to help people understand therapy, different kinds of therapy, and how they could benefit, and what was important, and how it worked for different types of, how they might be, for instance, what it would look like if they had a certain kind of problem and someone was treating them from a cognitive behavioral perspective, or someone was treating them from more of a psychodynamic perspective. So it kind of helped them understand and help practitioners understand how different modalities might work with someone with a particular kind of issue that they're experiencing.
You had mentioned several books. What other books have you authored?
Well, I mostly have written chapters in books related to cognitive behavioral therapy for children with anxiety. And I guess I'm also one of the co-authors of it's a parent guide to what's called the Coping Cat program, which is a program that was developed to treat children with anxiety. And it's actually one of the few programs in the UK that's being used to treat anxiety in children there in their national healthcare system, as well as have many years of lots of randomized controlled trials, including the CAMS trial, which was a large multi-sites trial in the United States to evaluate that protocol.
Now, here's one question. I'll leave you with this. Here's one question I don't think I've asked any of the presenters. Is CBPT used for treating young children with the...
Sorry, I didn't quite catch that.
Is CBPT used for treating children with OCD?
With OCD, with obsessive compulsive disorder. I think that there are ways. I am not as familiar with it with the younger children. Usually with children with OCD, it's often young children are usually working with their parents and in a family context to help them with that. There's some protocols. For example, there's a protocol called the SPACE program, which was developed at Yale with Ellie Leibowitz, and that works with the parents very closely with the children to treat OCD in younger children. I think OCD in very young children, I think it can be helpful for them to understand OCD. You could use cognitive behavioral play therapy to help younger children understand OCD, to understand how their brain is maybe working a little differently than folks who don't have OCD, so that they could understand that their brain gets stuck sometimes, that it gets caught. There's a lot of books and play materials that can help children understand it, and also why we would do kinds of treatments that would help them kind of talk back to the OCD monster, or which is their externalization of the push, the urge to try to do compulsive behavior, to help them gain control over their behavior. So I think it can certainly be utilized as a help. It would often usually also be a part of parents working with children as well. And within the context of play, you would want to do some kind of exposure and response prevention, which is helping the children have, perhaps they have a thought that something's dirty, but maybe touching it anyway and tolerating that discomfort. But with children, young children, they're not going to be able to do that very well. It's easier for them if they have parents helping them, as
Right.
well as if they in the play environment, it actually is easier for them sometimes to actually try some of those things, or maybe to do it first.
Sure.
Their
Yeah.
doll will do it first, or their bear would touch something that's sticky, or where they and not wash their hands, and then they could do it, understand it that way, and then they would go to do it themselves. And so I think it's part of that treatment package. I think it could be very helpful in that way.
Very interesting. Thank you.
Sure.
My pleasure to have spoken with you, and thank you for chatting with me. And this is Bob Kaiserman, and we'll see you next time on the next interview.